comment. Check to see if we have any directors online too. All right, ready? Welcome everyone to the Cook County Health and Hospital System special meeting with public hearings. We're reconvening from our meeting on July 31st. Will the secretary please call the roll?
Since a quorum isn't required, may I just call the directors who are present?
Yes, and I will. Well, I should make that note because this is a special meeting. We're just conducting a hearing. We're not expected to take a vote. We will not be taking a vote on any items. So a quorum is not required for this public hearing. So we will take attendance. You can call for the committee. There's just one person here from the committee, and then any other directors who are in attendance.
Correct. Okay. Director Harrington is absent. Director Lowry is absent. Director Robinson is absent. Chair Ryder.
Ryder is here.
And those directors also present. Director Bott.
Here.
Director Kim. Present. And Director Masuda Barnett. Present.
All right. Before we begin, just want to make note of the fact that when I left the house today, I was in a dress shirt and a sport coat, and both have been lost along the way, unfortunately. I didn't realize the sport coat wasn't with me until I got here. Dress shirt was in no condition for this meeting. With that being said, we are going to be receiving the budget presentation again from Scott Spencer, our interim CEO, and the CFO. Sorry, I just promoted you. CF, our interim chief financial officer, and like I requested at the prior dates when we were meeting on July 31st, if the directors could hold their questions, if any, for the budget presentation, which they previously heard, please do so after Scott's completed the entirety of his presentation, because again, things that you may ask about may be addressed later in the presentation. That way you have the full context of everything that is presented, and we will go back to cover anything that you have in terms of a question or clarification or a comment on in its entirety. We'll spend the time that is needed. After we receive the presentation and any feedback, comments, or questions from the directors, we will then move to public comment, where we will receive those oral testimony for those present or who have registered online, and acknowledge any written testimony that we have received. We do have speakers who pre-registered, but you do not have to have had. It's always helpful to have people pre-registered, so we know, for planning purposes how much time we will be spending on public comment, which is the purpose of this hearing, in addition to providing the information to the public about the budget. If we have anyone who has not registered, we will also ask for those folks who have not registered if they would like to speak. So after that whole mouthful, I'm going to move on to Scott, our interim chief financial officer, who to begin the overview of the presentation.
Okay, thank you. Scott Spencer, interim CFO for CCH. So first we're going to cover this year's accomplishments and next year's strategic priorities, and then we'll move on to the trends and budget drivers, and then we'll review the revenues and expenses and the health fund budget for 2027. So on slide 4 are accomplishments, just to highlight a few, despite going through exhaustive expense reduction processes, the health system has continued to make progress on key strategic goals in 2026. Some of these successes include being awarded Provider of the Year by Wellness West, helping patients achieve the most improvements in hypertension and behavioral health outcomes, launching Healthy Beginnings, the Department of Public Health's new program to support new parents and babies and reduce disparities. The health system was awarded a $5 million award along with the City Colleges of Chicago by Pritzker Traubert Foundation to create a workforce development pipeline out of Providence Hospital. The health system has continued to expand access to care by growing surgery volume at Providence by 45%. The health system was successful in achieving 75% of our value-based care metrics, which is up from 20% the prior year. We were successful in renegotiating our Medicaid encounter rate, as well as continuing to focus on supporting Medicaid enrollees through redetermination events and launching the CCH Medicaid Impact Work Group, which includes the Medicaid Get the Facts public education and outreach campaign. The health system has also earned a new Health Choice Illinois contract from the state, and as well has achieved a high water mark in terms of market share of the county care health plan at over 35%. Having a lot to be proud of as a health system, we want to keep this positive momentum going into 2027. Some of the strategic initiatives on the horizon include optimizing services at Providence to increase capacity and the number of patients we serve, focusing on maximizing clinical productivity, capacity utilization, throughput, and keeping patients within the CCH system. Focusing on entering into more value-based care agreements and achieving improved quality outcomes and performance revenue. Making further progress on our hiring processes, including additional insourcing and reducing agency costs. And demonstrating to county care members the value of receiving care at CCH. Continue to do all we can to ensure county care members and all Medicaid enrollees in Cook County retain the Medicaid coverage for which they are eligible, as well as improving revenue cycle through denial reduction and improved billing technology. As we move into the trends and budget drivers, take a moment to reflect on the federal landscape. We have seen already in 2026 the impact of federal funding cuts and significant financial pressure on the health system, reduced or including reduced ACA marketplace subsidies and Medicaid eligibility changes, which increased the number of uninsured residents. Looking to 2027, with the Medicaid work requirements and the change in the redetermination cycle, which we expect will result in more patients relying on Cook County Health as their safety net provider. So at the same time, other safety net organizations are expected to scale back services, increasing demand for our system. The result is a challenging financial dynamic, higher demand, more uncompensated care, and lower reimbursement. For FY27, we're projecting approximately $138 million less in patient revenue, which equates to about $100 million of additional charity care costs. So as we look at our at payer mix and the charity care costs, want to recognize our steady work to attract Medicare and commercially insured patients. This has helped to partially offset our Medicaid payer mix losses. As you can see, in 2027, we are anticipating Medicaid to decrease to 43%, and the uncompensated to increase to 30%. And then on the right-hand side, estimating $385 million in 2026 of uncompensated care and $485 million in fiscal 27. This slide demonstrates CCH's commitment to hiring. As you can see, the number of FTEs has grown from 2024 of 7,326 to 7,761 in fiscal 26, and anticipated that same number of FTEs in 2027. The orange line highlights the progress that the health system has made in growing or in reducing the agency expenses. In 2024, coming in at about $190 million and budgeting $70 million in 2027. Our key revenue and expense drivers, we are anticipating volumes to come in largely flat. We're expecting a per member per month increase of approximately 6% on the health plan. We've included revenue cycle improvements as well as various other rate increases, such as the Medicaid encounter rate improvement that I mentioned, as well as some improvement in our Medicare inpatient rates, as well as some benefit from a improved wage index. We're also expecting growth in domestic claims, which is the county care members receiving care at CCH. We are also including a proposed increase in the county tax allocation. As far as the decreases on the revenue side, as I mentioned, the change in the payer mix, decreasing from 49 to 43%, as well as anticipating directed payments to decrease. On the expense side, we have a 10% expense reduction carryover from FY26, as well as an additional 5% in FY27. We've included reductions in agency, professional and purchase services, and medical supplies. And we've also included increases in salaries and benefits, which include the cost of living adjustment as well as step increases, but also increases to pharmaceutical expenses driven mostly by inflation and utilization. And then, as I mentioned, the increase in the number of uninsured patients seeking care at CCH. So as we look at slide 11, it became clear in 2024 that major changes would be on the horizon for federal healthcare programs. And at that point, we started internal belt tightening exercises. We have or continue to make significant expense reductions, but this slide highlights the reductions that were made going into our fiscal 26 budget, which includes position freezes, agency spend, contracts, purchase services, as well as leases and maintenance. So approximately 217 million of expenses eliminated going into fiscal 26. Those efforts continue going into fiscal 27, as this slide highlights position freezes, as well as continued reductions in agency spend. And then in the middle of the slide, the over 400 million associated with the decrease in county care claims expense that we are anticipating. So the FY27 Health Fund revenue and expenses highlighted here, starting with net patient revenues, anticipating a decrease from fiscal 26 budget to fiscal 27 of 11 million. That number reflects both the changes in the payer mix as well as the revenue, including revenue cycle improvements that we are anticipating. As I'd mentioned, we're also expecting directed payments to decrease and the revenue from health plan services to decrease as well. And then you'll see down in the expense section, the offsetting reduction of 422 million in the claims expense. We're also, as I'd mentioned, seeing or expecting decrease in purchase services, contract labor, and maintenance and repairs. The increase in salaries and benefits, again, reflects the cost of living adjustment as well as the step increase. So I want to call out that the 2027 budget is predicated on a $40 million increase to the Cook County tax allocation. This would increase the county allocation from 168 million in 2026 to 208 million in 2027. We've been working very closely with President Preckwinkle and the County Department of Budget and Management Services. Certainly very grateful for their partnership and support on this increase. I want to just share this historical depiction of the county allocation to CCH on the previous slide, slide 15. The allocation has long supported our unfunded but mission critical mandates, including the Cook County Department of Public Health, the provision of correctional health care, as well as charity care. In 2013, as you'll see on this slide, the tax allocation was 250 million, which represented nearly 30 million of the budget. And in 2027, as I'd mentioned, the proposed tax allocation is 208 million, which would represent 12% of the budget. So we have been tasked with closing a $40 million gap in the budget. This slide shows what we would have to do to get there, not something we want to do, but what we would have to do if we don't get additional county funding. So the expense reduction efforts have made significant improvement in our ability to absorb the looming federal cuts. But we're at the point where we have cut to the bone, and despite being able to avoid facility closures and layoffs up to this point, we've reached a place where the belt tightening alone will not be enough to offset the scale of the revenue reductions we're facing in 2027. So the potential cuts that could close the budget gap include closing a community health center, reductions in clinical service lines, and then also cutting offices and programs that provide wraparound support services. So we are, however, cautiously optimistic that this can be avoided through an increase in the county allocation. So now we'll go walk through the departments, starting with Stroger. So as I'd mentioned, a 5% expense reduction, which includes a 10% reduction from fiscal 26. We'll continue to focus on reducing agency. We also have included cost savings initiatives, including the insourcing of oncology nurses and advanced practice providers, as well as some insourcing associated with plant operations and facilities management. At Provident, we also have the 5% expense reduction along with the carryover. We'll continue to focus on expanding and maximizing capacity of outpatient services provided at Provident, as well as continuing to focus on reduction of agency. On the outpatient side at ACH and in core, continue to focus on increasing patient visit volumes across the system by improving access, optimizing provider schedules, and just overall better use of clinic capacity, as well as continuing to focus on reducing agency. Correctional health, which includes CIRMAC and JTDC, includes the same 5% expense reduction, and then efforts will continue there as far as continuing to be, the continued efficient use of resources. Public health, continued funding of ARPA and grant positions, as well as community immunization programs, as well as programs targeted at chronic disease prevention, as well as healthy beginnings programs, as mentioned earlier. Health administration, continued revenue cycle optimization, including managing denial reductions and using improved billing technology. We will continue to tighten the belts on non-essentials where we can, and we'll continue to focus on reducing agency cost. Health plan services, so this, again, just to highlight the per member per month increase in the rate that we're anticipating, expecting the average monthly membership to be just below 329,000. And then the next slide, this slide just shows the projected membership for each population and the contribution by each membership group. And then the next slide here shows the membership from the last few years. And just to highlight here that Medicaid enrollment overall has declined by 23%. During that time frame, county care membership has declined 16%. Again, just highlighting the strong market share of the health plan. So last couple slides here, just want to summarize the FY27 takeaways here. The proposed budget is $4.7 billion, which is nearly $440 million less than FY26 and reflects both the health plan and healthcare services. Federal Medicaid changes are fundamentally reshaping the health system's financial outlook, as I've already mentioned. Our operational efficiencies alone cannot offset federal funding losses. Since 2024, the health system has eliminated more than $300 million in expenses through operational improvements. But again, we are cautiously optimistic and regarding the additional support from the county. And again, just to highlight, the budget includes $40 million in additional county funding to help avoid patient care reductions and layoffs. And then lastly, as regarding the mission of the health system, remains and will always be to provide high quality, accessible care and services for all residents while navigating which will certainly be an unprecedented landscape in terms of federal funding. And with that,
thank you, Scott. Before we go to any questions or comments, the board members, I'm having Debbie go back to 2 slides that I don't have any questions on. I just want to highlight a few things. Wasn't that slide? I wanted, yeah, you know what? I want that other side. Go back to the tax allocation slide. I'm sorry. Okay. So when you look at this slide, what you're going to see, and if you were to go back a few more years, you see an even steeper drop off. I've got, and yeah, our chief business officer, Andrea.
No.
Chief strategy officer. Business officer is in between that. Yeah.
That's right.
All right. Our chief strategy officer. Similar. Chief strategy officer who's worked at both the county and at the hospital system could tell you the subsidy came as the county was shifting the way it was spending money, and also the strategy around us moving forward with the managed care network and the health plan. Over time, costs increase. So you're going to naturally see from where we got to the lowest county subsidy. My eyes are not that good. I want to make sure. I would say 2018, 2019. Yeah. You're going to see it. You're going to see it step up. But we were, and I would highlight, because I personally got involved with pushing for a higher county subsidy between 2020 and 2021, which I think everybody remember, at least those who were around then remember some of that. We actually amended the budget on the floor to put more resources into Provident and into other parts of the system. That was also the beginning of COVID, and we received, we were able to, during that period of time, not only catch up on costs and recognize that the subsidy would need to increase with a natural cost escalator that you would have in any provision of services, but also the expansion in some cases of what we could do as the public health system in terms of providing hospital care, clinical care, and public health services to our community. I want to compliment the team on working with us the last several years and institutionalizing some of that, and also recognizing that when we have seeded some of those expansion of services, that we now have to look at ways to insource, because in a lot of cases, we've talked about this at the finance committee, you expand quicker than you can onboard people or add positions, but that's not outsourcing is not the sustainable way to build service lines. That you have to recognize that you need to expand your infrastructure and your footprint, and we're doing that. We've spent a lot of time the last couple of years working on that issue and bringing more people inside the health system as permanent employees, providing critical services here at Cook County, at Cook County Health. What has intervened during that period of time is not just the sunsetting of ARPA, but House Resolution 1, the big beautiful bill, the big ugly bill, whatever technical or pejorative names we give to it, it's going to do a lot of damage to our community if we as a community do not stand up and fight to maintain and grow the services that we have, and everything is possible. Debbie, can you now go to that other slide? There's a lot of other details here. Now, we look at, this is one pathway to that $40 million. If we were not to achieve the $40 million, there's probably others as well. This pathway of closing the $40 million gap without revenue being allocated to us from downtown is a non-starter for me, and I'm going to explain why. The community health centers and the specialty clinical services lines that we provide outside of our footprint here at Stroger and Provident is how we get people healthier, right? This is how we provide the social safety net, and we provide relief not only to the hospital system in terms of what we need to do to protect the health, but if we start with these community health centers, we make everyone healthier. A strong public health system makes people healthier and less need to rely on managing chronic illnesses that we can catch earlier and manage better. Cutting one of these clinics would take us in the wrong direction, because cutting one clinic means that we've now opened the door to cutting more clinics down the road, and that's we can't move from heading in a positive direction to a negative direction. The housing, food, research, and behavioral health programs, this is what I call the Dennis Deere bucket of things that we do here. I think we've all seen the critical needs, again, around supporting community health through providing secure housing, access to good, healthy, nutritious food, and the education around that, the important research that we do here at Cook County Health, working with our patient population and with our providers to make sure that we are doing things to help not only treat our urban community here in Chicago and Cook County, but that research can help support other regions of our state and our country. And I think we all know what underinvestment in behavioral health can mean here, specifically in the city of Chicago, because we've seen that movie, and it didn't end well. And again, this is a much smaller line, but we also have had the incredible opportunity to support people through grants and scholarships to either help them have a shot at starting their career in medicine or support the things that make our system stronger through providing grants to organizations and to individuals that help drive the mission. This slide really represents how we become resilient and continue to be resilient, and resilience creates strength. It develops muscles and it makes you stronger. There's probably another way to get to $40 million that cuts that just randomly, and I've seen this before, like assign a percentage and cut everybody by that amount. That means less nurses in ICU, in the emergency room, less environmental service to make sure that the hospital is maintained to the standards that which we have really grown well into. To the environmental service people who are full-time employees, and the folks that we bring in when we have to do deep cleanings. This place is incredible, and I believe all of our recent scores and audits reinforce that, and I'm proud of everybody here who's done that. I will not go backwards. So, before we get to any other questions, I want to highlight the fact that, you know, we all have roles here. This institution's job is to provide a budget in collaboration with working with downtown. And I want to thank President Preckwinkle and her budget team for working with us on this. We're all community members. In addition to serving on here, we all have networks we work in, and to the extent that we can assist in our individual roles in making sure that that $40 million gap is covered through supporting additional revenues that will have to be passed through the county board, I invite you to join the party that I'm throwing, because that's what we're going to do. Is we're going to make sure that that $40 million gap not only is to support the county closing that $40 million gap, we have to help as a community make sure that people understand that the rational decisions we need to make and support the incredibly important public services that we provide here through Cook County Health. That's my opening remark that's coming in on the back end of Scott's presentation. So now I would like to go to the other directors for any questions or comments before we go to public comment. Dr. Kim.
Yeah, Scott, I think, you know, we looked at 26, 27 impact, but in fact, what we need is longer term impact. By this budget cut this year will actually increase budget, you know, deficit greater going forward, because we're not providing certain, you know, programs or potentially that will actually add up more healthcare needs in the future. So I wonder if you can actually do a longer term projection of what's going to happen to us not providing certain care this year, next year. That's going to add up to, you know, longer chronic conditions that we have to take care of. So I wonder if we can cut research programs, but internally we should prepare to do that sort of projection, the impact of current budget issue. The other thing that I wanted to say is that I didn't see, you sort of mentioned improving sort of value-based contracts and things, and it's supposed to provide better care, but also reduce cost, right? So I wonder, like, what you think of, you know, what our plans with the county care, how much of expansion we're thinking about in terms of value-based contract care contract, and whether that's going to help us with, you know, budgeting going forward.
Dr. Kim, I think Andrea can answer some of these questions because they're outside of Scott's scope in terms of the projections on what could happen to the care we're able to provide, and then your second question as well.
Yeah, and I'll take that one first on value-based care. You know, we've entered into an ACO this year, Valvana, and we're doing pretty well, but it's our first year doing it, and it's really an opportunity for us to look at our processes and try to apply that in a payer agnostic way. It is a shared savings model, so it's too soon to know if we will hit the metrics that will give us, you know, that payment for performance. But we have had some early success with Wellness West, which is a transformation project where, based on outcomes, we've actually earned performance bonuses. And we have 4 other value-based care contracts right now, and it's too soon to tell, but that's where we're trying to earn money to cover that care and then also prevent that more acute, you know, medical issues, by doing the preventative work. So that's on value-based care. I think actually I wanted to ask Scott, like, I think we can take back the longer-term projection and work together on that to share something back with the board, unless you have something already.
No, don't have anything at the moment, but
Yeah,
yeah, we can do that.
but yeah, that's a point well taken, because this is just the beginning. Like 2028 is going to be hard as well, and so we should be looking forward.
Dr. Bott?
Thank you, Mr. Chair, and echo your sentiments on President Breckwinkle and the budget team working with us on this. I think this long-term projection piece is important, and so I'll be curious about that. I agree that this 40 million gap is a challenging gap to address, but we have to figure out other ways to do that. I was curious about whether we can increase the Medicare and commercial mix here. I mean, that may be, another opportunity, and then a combination of other service lines that could strengthen as a result, and then that could lead into stronger component payer mix.
I think that could be something that happens on the managing of the budget, right?
Yeah.
So when we get out, as we go through the budget year, and then help us make adjustments the way through, I think, in terms of how we're booking it now.
Right.
I think I think where we're at in terms of projections are about as stretched as we can make them. But I think that what you're suggesting in terms of managing the budget and increasing our Medicaid and our commercial, again, we're gonna see so many challenges with the Medicaid and the ACA related services we provide, that we're gonna be looking at a situation that's going to be similar to pre-ARPA, pre-COVID, with what I believe is going to be a instability of disproportionate care funds that are going to come to help us backfill after the fact. And we are going to need to be on our toes, but also if there are opportunities to reverse some of these policy changes in Washington, we need to be educating the public about what we can do to force change in Washington. Of course, that's going to, real change likely won't happen until January of 2027. But we need to start educating everybody right now. And I know Marcelino was here earlier, and I know, there he is. He's tucked behind Scott. Our team is also doing outreach, direct community outreach on how policies are impacting the ability, not just of Cook County Health to provide care, but all of our safety net hospitals in this region who are also even more exposed than us.
Can I make a comment?
Sure.
One comment, Scott and I were looking at the numbers of commercial and Medicare actually, and when we looked pre-Affordable Care Act to now, we've actually tripled our commercial percentage of payers, and we've almost doubled Medicare. And so if we hadn't had done that, achieved that, our uninsured number, our payer mix would just be more between Medicaid and uninsured, and we would have taken a bigger financial hit. So we're proud. I mean, so that's a nice positive from it goes back to 2012, 2013, right? But we have diversified our payer mix, and that has helped us overall, financially.
Great. And then the FTE increase in county care is related to care coordination coming in-house.
That's right.
Correct. Yeah.
That's right.
And are there specific services related to care coordination, or just care coordination as a whole, whatever county care was doing externally, bringing all of it in-house? Or just, there's some services that'll come in, some not.
Yeah, I don't know specifically. I know that it's care coordination. We can get you more details though, specifically as to those efforts.
That's fine. And then the other question is, have you accounted for at all, and this may be more projection follow-up, the issue of starting January 1, there's unbundling of maternal care. So the bundles payment around, that episode of pregnancy, birth, postpartum care is being unbundled. And that may have an impact, just on rev cycle and other things to plan for.
Yeah, so not specifically, but we'll have to look to see what kind of impact that has on the long term.
Yeah. I'm good, thanks.
Jeannie, you good? All right, okay. All right, now that, we've heard from, members of the board who are attending the special hearing, we are now, thank you, Scott. We're going to move to, receiving public testimony. Each speaker has 3 minutes, and the secretary will remind the speaker when there is 1 minute left, and again, when their time has expired. Did we receive any written testimony?
We did. We received written testimony from Dania Perillo Flores, and it will be sent out with a recap tomorrow morning.
Okay, great. Do we have anyone that's registered to speak that is joining us virtually?
Yes.
Okay. Do we want to go to that person first? Is that how?
Whatever you prefer.
Let's do that first.
Okay. The first speaker, Opeyemi Oduyoungbo, and I apologize, I probably mispronounced your name. Opeyemi?
No, you said it correctly. Can you all hear me?
Yes.
Okay. All right. So, all right. Hello, everyone. My name is Opeyemi Oduyoungbo, and I am the program director for Respiratory Health Association. Thank you for giving me the opportunity to share a few words with you all today. At Respiratory Health Association, our mission is to prevent lung disease, promote clean air, and help people live better lives through education, research, and policy change. And our work includes programs that support adults who want to quit smoking, asthma management education for students and caregivers, and deliver vaping prevention programs in school and community. A key part of the work that we do is collaboration, and we truly value our partnership with the Cook County Department of Public Health. Together, we are implementing a school-based vaping prevention program that provides students with accurate information about the risk of vaping and helps them make informed choices about their health. With CCDPH support, we reached more than 5,000 students in this past school year. This education is timely and very necessary. After one of our presentations, there was a girl in 7th grade who came up to one of our educators and thanked her for sharing the information with her and her classmates. She mentioned that her mother passed away from cancer and she used vapes regularly, even though her doctor advised her to stop. She didn't. One reason was because she already had a heavy nicotine addiction at that point, and also because her mother did not think it would be that harmful. She believed her mom may have passed away prematurely because her smoking habits brought on more damage to her health, and that she realized that it was important for students to learn the effects earlier than later to avoid what happened to her mom. She was very grateful for our presentation, and she continuously thanked our educator for coming. There have also been a few other students who mentioned that they would encourage their parents, older siblings, and others to stop vaping based on what they learned in our presentation. Encounters like this highlight the importance of early prevention and demonstrate that students are being exposed to these products at a very young age. Funding and partnerships like the ones we have with CCDPH make this work very important and possible. They allow us to reach more schools, provide evidence-based materials, and ensure that our educators can deliver consistent, high-quality programs. These efforts help us to engage students early on and contribute to long-term improvements in community health. Thank you so much.
Thank you. All right. Deb, do we have any other, anyone for virtual testimony?
Nobody registered, no.
Okay, why don't we go to the registered folks next?
The next speaker is Bertha Mariscal.
And I believe we're going to get translation. Is that right? Are you providing the translation? Oh, great. Thank you.
Hi, buenas tardes.
Good afternoon.
Mi nombre es Berta Mariscal
My name is Berta Mariscal.
y soy sobreviviente de cáncer de seno desde el 2004.
I am a breast cancer survivor since 2014.
En el
Oh,
2004.
2004.
En el 2009,
In 2019, 2009.
no,
2009.
2009.
Okay.
Gracias al Hospital Stroyer,
Thank you to Stroyer Hospital.
pude encontrar servicios médicos,
I found medical healthcare,
oncológicos,
oncology,
gratuitos.
free.
Mamografía sobre todos los recursos,
Mammographies and all other resources,
sobre todos los estudios
especially the studies
y los medicamentos que necesitaba en ese año.
and all the medication that I needed that year.
En el 2019 me diagnosticaron diabetes 2
In 2019, I was diagnosed with diabetes 2,
y desde entonces mi doctor primario,
and since then, my primary care physician,
que también pertenece al área del COCONI o del Stroyer,
who's also part of the Cook County Health Stroger family.
además los medicamentos también han sido gratuitos al igual que el médico.
And all my medication and healthcare visits have been free during that time.
Y gracias al programa que tienen por envíos, me llegan a la casa.
And thank you to the mail order pharmacy program, I get all my medications at home.
Y gracias le doy al Hospital Stroyer por todo el apoyo que dan a las familias, porque no solo soy yo.
And thank you to Stroyer Hospital for all the care that you provide all families, because it's not only me, it's a lot of different families.
Ya que somos de bajos recursos,
Because we're low income,
y le doy las gracias no solo por mí, sino por los miles que somos.
and I thank you all for not only for me, but for the thousands of people that you help.
Y le doy las gracias a las enfermeras, a los médicos
I want to thank the doctors, the nurses,
y todos los que trabajan en esta área de salud.
and everyone who works in healthcare.
Gracias a este programa
Thank you to this program.
hemos salido adelante por nuestra salud,
We have moved forward due to our health,
con manos de los doctores.
due to the doctor's hands.
He estado en otros hospitales antes de llegar aquí
I was at other hospitals before coming here,
y nunca me han tratado igual.
and I wasn't treated the same before.
Estuve 2 años fuera del hospital, del programa del hospital,
I was outside the healthcare of this hospital for about 2 years.
cuando regresé, todos se abrieron todas las puertas de mi salud.
When I got back, everyone welcomed me back with open hands, and talk to me about my health.
Y les doy las gracias. Espero que
And I,
sigan teniendo el apoyo para todos.
and I give you thanks, and I hope that you keep this program to help everyone.
Ya que somos de bajos recursos y sin este programa no saldríamos adelante.
And even though we're of low income, without this program, we wouldn't be moving forward.
Gracias por todo.
Thank you for everything.
Thank you for sharing your story with us. I should flag we have folks who need, or who are providing translation. We will bend the time limit rules a little bit, which we did that time. Thank you very much. Next speaker.
The next speaker is Beulah Brent.
I'm joking.
You don't want them translating numbers.
I do not, I'm fine. Giving honor to all of you all that's here, to the board. I appreciate the opportunity to come in to talk about what Cook County has done for me personally, as well as the community we serve. And thanks to Marcelino and his team. I retired from county. I've actually worked at county for 30 years. So I retired, and for some reason, I can't leave county alone because I'm still working with county. So we just happened to be one of the first organizations that was brought on board during COVID to be contact tracers. So during that time, we did a lot of our work out in the community with county, and we also did a lot of our COVID injections with the mobile van that county provided. So that means that I'm still connected to county in all the ways that's necessary. And thanks to Marcelino and his team, we do quite a few outreach programs, and they send whatever help that we need. And at these events, we have HIV testing. We still offer the COVID testing, and I can call Marcelino and his team, and basically that. I just asked him today, have you ever said no when I asked you for anything? And he said, well, I don't think so. And now that I look back, I don't think he's ever said anything. And due to the fact that we got involved in the contact tracing and all the other things we do, again, what I didn't tell you is I am the CEO for Sisters Working It Out. And we are a women's health organization with a focus in breast and cervical cancer. And I got my passion from that right here at Stroger Hospital, being the manager for the mammography department. And when I saw the disparity in the community, it fueled my energy, my passion for what it is that I saw in the community. And to be able to bring all of this to the organization. So I think my husband said I quit one job and picked up 6. But when you look at the community and what it is that we see in the community, working with CCH and IDPH and all the other H's, it has been a tremendous blessing to be able to reach back and say, you know, I left county knowing that I learned so much. And just a really quick personal story is while I was working here, my son was diagnosed with an autoimmune deficiency. But I have to tell you, we went 2 years before we could find out what was going on with my son. And with the insurance that we had to somehow, you know, it's over now, so I can kind of tell you what happened. We had to somehow, you know, bring my son on this side of town just to be able to get him in Stroger Hospital. And when I worked with the oncologist to find out, my son was actually, he had a stroke at 25. He had a PE at 26, and then he lost the kidney at 27. And it was actually county who was able to help us diagnose the issues that we had with our son. And thanks to the oncologist, the hematologist right here at Stroger, that's how we found out in 3 years what happened to our son. And today he's still alive because of Cook County. So I have so much to be grateful for. And Marcelino, don't go anywhere, and they're going to give us these funds so we can continue. Thank you all so much.
Thank you for sharing that with with us, one thing I take away from that comment is some people see public hospitals as a last choice, but the work that we've done here at Stroger and Providence, especially over the course of the last, I want to say, let's say 5 years, 6 years. We were on a ramp before that, but for the last 6 years, we are our trajectory. We are probably the strongest we've ever been, and we are certainly a hospital of first choice.
The next speaker is Sarah
It's
Esparza.
on my time to comment, though. I'm supposed to be letting other people know. I can't help myself. Welcome.
Good evening. My name is Sarah Esparza. I'm a lifelong Cook County resident, and I'm currently the Community Outreach Coordinator for Family Solutions of Illinois. Thank you to the Cook County Health Special Finance Committee for the opportunity to share my partnership testimony at this budget hearing. At Family Solutions, we provide behavioral and mental health services to Medicaid recipients across the county. Our staff is filled with Chicago's finest case managers, mental health professionals, and social workers. And it's my role at Family Solutions to connect our community members to our comprehensive therapy, counseling, and case management services, and to seek out aligned partners to refer folks to our services. And being on the advisory committee led by Marcelino Garcia and his team at Providence and Belmont-Cragen Cook County Health locations has allowed for me to hear about so many opportunities within Cook County Health, especially the benefits of county care. Our staff of clinicians love to hear about the perks like rewards for preventative care that their clients benefit from. We also deeply appreciate the fact that our services at Family Solutions are completely covered by county care for the people we serve, allowing for them to focus on improving their mental health instead of focusing on making a co-payment or a deductible they can't afford. I've been extended invitations to amazing opportunities such as the Triage and Stabilization Center ribbon cutting at Providence, tabling at redetermination events, and more. The Triage Center is such a wonderful resource for us to depend on for our clients who are in crisis, and also the consistent, accessible redetermination events allow us to support our clients in this difficult time under that one bill. Speaking of redetermination, as an organization working within the spectrum of MCOs, I'm happy to report that over the last few months, we've seen an improvement in prior authorization approval timelines and communication, and we would love to continue to see this progress, and it makes us proud to have County Care as one of our top MCOs. I also must note that our Family Solutions community, not alone, felt a devastating impact that we are still grappling with when the HBIA program closed last summer and we had to discharge all of our undocumented clients. It's been incredible to work alongside the folks within Cook County Health's behavioral health initiatives and to know that we are in alignment with the county's priorities that seeks to improve access to a high quality behavioral health care system. We look forward to being in attendance at the upcoming 2026 Cook County Behavioral Health Summit and hearing about how these investments will continue to uplift the communities that we serve. And I also know that these priorities are in alignment with Illinois policy and priorities as well. We have also been able to receive dozens of referrals from care coordinators at County Care, as well as the Cook County Juvenile Justice Care Coordination Team. I've seen firsthand how investment in quality care coordinators and social workers who know how to refer and collaborate with an agency like mine can lead to successful outcomes for our Cook County residents, one referral, one resource at a time. Thank you very much.
Thank you.
The next speaker is Susan Avila.
Good evening. My name is Sue Avila. I'm a registered nurse and a member of the 7th District Health Task Force. Cook County Health is the backbone of our safety net. When it weakens, the entire safety net fails. It is not merely a budget line. It is a lifeline for thousands of people. Despite assertions that the frontline services are not being cut, we are told of long waits, understaffing, and language barriers at Stroger Pharmacy. We are hearing of patients, especially those who are self-paid or uninsured, being denied essential services. Women are being turned away for mammograms unless they pay $62 up front, even though state funds exist for those screenings. Surgeries are reportedly being delayed because patients are asked to establish a payment plan before a procedure can be scheduled. If a patient cannot complete a plan, will they be sent to collections? These practices deter people from seeking care, deepen health disparities, and drive up costs over time. This board is entrusted with ensuring that our safety net does not break. To fulfill the duty that we need, transparency, accountability, and meaningful community oversight. We need board members who will ask the hard questions and commit to ongoing discussion. Budget and policy decisions cannot be made behind closed doors or limited to an annual hearing. Your own budget documents show an almost 100% increase in health administration positions since 2022, while frontline services have seen little or no comparable growth. We must prioritize investment in primary care and frontline staff who deliver it, not administrative expansion. We need bold, concrete plans, not talking points, to organize and defend our health system. That work cannot be accomplished by highly paid clinical leadership that do not practice within our system. Leadership that lacks experience in leading large urban health systems or are not even licensed to practice medicine in Illinois. Their credibility to lead us through these difficult times is diminished. They do not see patients in our facilities and are not standing with them as they work to make the system better. This public health system belongs to the people of Cook County. Its future must be decided with us, not for us. This board must be transparent, prioritize frontline care, and actively partner with state and federal officials to repeal or offset the 2027 Medicaid cuts. Our patients, our staff, and our community health depend on it. Thank you.
Thank you for your comments. The items are relating to budgetary investment. I would like to have brought up at the next on the agenda for the next finance committee meeting, so we could see whether where we're at with addressing those items through the budget and through our managing of this past year's or previous year's budget to make sure that we are where we're at and whether we're we're properly deploying our resources.
Okay.
So,
all right.
All right. You're writing, so I'm looking at you.
I'm writing it down.
But yeah, it's the making sure that we're taking advantage of all state and federal funding,
Yeah.
and that we're providing the programs that we can, and making sure that we're, whatever processes, we're making sure that we're, providing care and navigating the managed care aspect of it. Our mantra is we take care of people regardless of their ability to pay. So got to make sure that I just want to check in on that, make sure that we're doing it. All right. So I invite anybody to come to the next several meetings. We'll try to, anything that comes up here, we'll try to continue to address it in our meetings to the extent that we're able to. Next speaker, Deb.
The final speaker is Maggie Mellon-Zerwinski.
Hi, everyone. My name is Maggie Schwinski. I'm with the Active Transportation Alliance, and we're a nonprofit for walking, biking, and transit. And we advocate for creating healthier, safer, more equitable communities in the Chicagoland region. So first, congrats to Cook County Health for placing first in this year's Bike Commuter Challenge. So well done. to share a little bit about our current work, we're working directly with direct funding support from Cook County Department of Public Health. With them, we're helping more than a dozen Cook County communities strengthen their applications to the Illinois Transportation Enhancement Program, also called ITEP. And ITEP is the state's largest source of funding for walking, biking, streetscapes, and trail projects. So this year, the Illinois Department of Transportation is making a record $157 million available through the ITEP grant. So that can fund sidewalks, bike lanes, safer pedestrian crossings, trails. So, and that helps people reach destinations like schools, jobs more safely, and getting in some physical activity as well. So these investments improve both safety and public health. And according to the Cook County Safety Action Plan, pedestrians and bicyclists disproportionately account for 25% of all fatal and serious crashes in Cook County. So investing in that safer infrastructure is incredibly important for vulnerable road users while creating healthier, more connected communities. So a great recent local example of an ITEP funded project is in Streamwood. They just built a bike pedestrian bridge over Illinois Route 59, and it transformed a major barrier to create safer connections that allow residents, including kids who are walking and biking to school, get to community destinations safely. But unfortunately, ITEP is very, very competitive, and communities with limited staff capacity and resources often struggle to prepare strong applications. So that's through our partnership with CCDPH, we're bringing additional resources and capacity to historically disinvested communities. So we're working with over a dozen Cook County communities, including Linwood, Hazelcrest, Broadview, Park Forest, to help them identify projects, refine their project scopes, resolve technical questions with IDOT, and develop competitive applications that align with ITEP scoring criteria. So we're with CCDPH's financial support. We also hosted a countywide ITEP webinar highlighting resources from Cook County Department of Public Health, the Department of Transportation and Highways, the Bureau of Economic Development to help strengthen local partners and ITEP applications. So thank you to the Cook County Department of Public Health for investing in this work and helping ensure that more suburban Cook County municipalities, regardless of their size or their capacity, have a fair opportunity to secure these critical transportation funds and build healthier communities. Thank you.
Thank you. Do we have anyone else registered to speak?
We don't have anyone else registered.
Is there anyone else from the community who did not register to speak, but would like to offer public comment? Anyone? Not seeing anyone. I will, before we recess, I will remind everyone that we have a public hearing this Thursday, August 13th at 10 a.m. We again will go through the budget presentation, and we will again take public comment. You know, I invite anyone who is here today that wants to hear the presentation again and offer additional comments, another opportunity to have your voice be heard. And do we have, is that the last public hearing before we go back to the Finance Committee?
That is correct.
Okay, all right. So with that, we will, I'm going to recess this meeting until August 13th, which I believe is this Thursday. My son's birthday is on the 14th at 10 a.m. The meeting will occur here in the board conference room at the professional building. That's the right name of the building, right? Okay. Thank you.
Thank you.
I think I know all these things.
How are you doing?